So Uganda is still in the list of countries that World Health Organization has classified as not allowed to externalize medical professionals.
2 weeks ago, the Ministry of Gender and Labour acknowledged that the health sector faces challenges, including limited employment opportunities for many who are qualified to offer service. This comes on the back of several strikes by interns in the health sector due to government's inability to absorb them into the workforce due to budgetary constraints. Uganda's health facilities are grappling with staff shortages, and the country remains below the WHO recommended doctor-to-patient ratio. But the Uganda Nurses and Midwives Union thinks it is time things changed.
What we need is employment, because look at the money a parent pays. The institutions that train nurses graduate more than 5,000 per year.
The Uganda Nurses and Midwives Union believes that there is no need to worry about running out of health workers, as the Uganda Nurses and Midwives Examination Board certifies more health workers than the government can employ each year.
And again, they stay here, and how expensive it is terrible to us. So as leaders of Uganda, of the nurses and midwives in this country, we request the government really to lift the ban, to try to talk with WHO, and the reference actually to the number of the nurses who have graduated and also registered to practice with the Nurses Council. We are very many.
However, asked about whether there is room for growth in the sector, the union insists that there are more than enough nurses and midwives graduating each year to ensure that both the foreign and local markets are well served.
So you can look at the 5,000, and those are very many people that graduate. And you can also compare that with the number of nurses that the government has absorbed.
Birungi also suggests that the government could work with the union and other health organizations on how to distribute between workers who want to stay and serve at home, allowing for all to gain employment.
So that we see how many go and how many stay in the country. I have always said that it is very important for people to go abroad, especially scientists, because the nurses abroad are paid well. And that also means that our country, the economy, will improve.
Away from this, the Uganda Nurses and Midwives Union has also weighed in newly imposed restrictions on qualifications of those going into nursing and midwifery.
I would like to advise you that even give that you continue and do sciences up to senior 6. Because when I was talking about the salary, you realize that the certificate holders are getting less than the degree nurses. So if we need a big number of nurses who can get a better salary and who can be employed well by government, let us encourage the certificates to phase out so that all of us, we are well qualified. That is my reasoning. And the other thing also, if you want to go abroad, you cannot get a job at a certificate level. All those European countries, they start from registered nursing.
According to Birungi, there is no need to discriminate by sex. However, she agrees that there are more advantages for those joining the sector as diploma holders or higher.
Men being midwife, they should allow them be midwives, because the doctors themselves are men. And now why are you refusing a man who is a nurse to become a midwife? Because I know the contention was on examination of a mother. Why not? By the way, for your information, when these mothers have wounds in any of the private parts, it is the nurses who clean the wounds. So why is it that you don't stop us that, don't do this? If they have to put catheters, for example, they are giving birth, all of us, we put catheters.
She closes out by reminding the president of promises that he made to the Nurses and Midwifery Union.
And the scheme of service is not also implemented, calling for more degree nurses and diploma nurses, but the money which is allocated to the district cannot pay that degree nurse and the registered nurse. So it is still a challenge. Actually, I think we are very much grieved, and we need to be prioritized.